It's recording.
Amazing. Thank you. Good evening, everyone. Thank you for joining and welcome to the Social Services and Health Committee meeting for Community Board 17. My name is Montserrat Oni and I am chair of this committee. Just give me 1 second. So would like to first start with a roll call. If we can all just introduce ourselves and our relationship to the committee for the record. Ms. Reed, would you mind starting? Oh, okay, Tiffany, can you start?
Hello. Hi.
Yep.
My name is Tiffany Anderson, and I am the Brooklyn Cab Chair and also a member of the Social Service Committee and the Personnel Committee.
Thank you so much. Ms. McCain-Brown?
Good evening, everyone. Monica McCain-Brown, committee member.
Good evening, welcome. Vanetta?
Hello, Vanetta Sylvester, committee member.
Thank you so much. Amanda? Amanda Bilal?
Hello, I'm sorry. My
No
Wi-Fi
problem.
was being a little silly. Amanda Bilal, I'm from Bridging Access to Care. I'm not a member, but I am a community member.
Of
Good
course,
evening.
okay.
This is
Welcome. Thank
Sabin
you
Shaw.
for joining. Sabin, sorry, could you go again?
I'm from Bridging Access to Care. I am the community partnership and event coordinator.
Fantastic. Welcome. Ms. Reed, are you able to
Yeah, I'm sorry. I couldn't get back in.
No
I'm
problem.
Janice Reed, community member.
Thank you. And Sabin? Sabin, are you there? Okay. Can we know for the record that Sabin is logged on, but maybe she's having issues with mute. So for the chairperson's report, again, welcome. Thank you all, for consistently joining. The biggest issue that we are, or I don't want to say the biggest issue, but one of the concerns I have is to figure out more about the nurses strike that's going on in the city and how the social services committee can support nurses within the community and make sure that the community is supported. I did speak to the community liaison for SUNY Downstate, and Downstate is not affected by the strike because their nurses are in a different union than the one that is striking. But, when we were talking about the potential closure of Downstate and the state of hospitals in our community, one of the things people have said is, nurse quality, but also like nurse, their own standard of care, standard of excellence, and just want to make sure that we're informed on, what exactly nurses in the city feel like they're missing, as well as, if there's anything we can do to advocate for support. So I have reached out to a couple of nurses to see if they'd be willing to come talk to us, at this meeting. Haven't gotten any hits back, but if people are in community with some nurses as well, that would be great. If you can share that information. Also, I'm in communication with Community Health Network, which is a local health organization that offers educational programming throughout the city. And they have offered to come to this meeting to do some education. We were hoping for this week, but for this month, but they asked to reschedule to next month. And so a member of their family planning unit is going to offer up some education for HIV awareness. So we're trying to get a flyer up to actually distribute it out so that we have attendees outside of just the regular attendees for this meeting. And the last thing on my report is just that as we're already in the new year and going into April, or like April's coming around, which is when we normally have our health fair, want to get started with planning that and reaching out to organizations that might be interested in tabling. This is smaller typically than the board fair that happens in October. And usually this is just right near the board office on Farragut, but it's still, important to get resources out to members of the community if we can. So again, if you all are partnered with any organizations that would like to volunteer and attend, that would be great. We do have some time, so would be great to get some sort of like mobile health trucks if we can. We've talked before about blood draw, as like blood donation, as well as maybe a mammogram truck. But usually those things schedule out, anywhere from 4 to 6 months out. So now would be the time to reach out to them if we want to get them locked in for April. So just want to put that in people's minds. And the last thing I just wanted to mention is that there is a blood drive going on at Downstate. It was today and tomorrow. So if people are blood donors or want to share that information just so that people can get out there, because it is important to have, as much blood donation as we can, especially in Black communities for different reasons. So that ends my report. Are there any questions?
Do we know the date of the fair in April?
No, so it is not, we haven't set a date. I want to confirm with the board staff if there are any other committees having events, but it's usually like the second or third Saturday in April. So there's some flexibility, especially if there is an organization that's willing to come volunteer, but they're only available on, the second Saturday or the third Saturday. We're flexible for now, but by the end of February, we should lock in the date. Any other questions? Okay, I see we have two people who joined after roll call. So Khadijah, would you mind introducing yourself for the record, please?
Diana Gay, committee member.
Welcome.
Thank you.
Khadijah Oluo, community board member.
Welcome. And Ms. Julius, thank you for joining. Could you introduce yourself for the record?
Hi, Nicole Julius, community board member.
Amazing. Thank you. So next on the agenda would be adopting the minutes. Ms. Lyons, do we have quorum to adopt the minutes from the last few meetings?
No, not yet.
Not yet. Okay. Thank you. So moving on, does anyone else have any new business that they'd like to discuss?
Good evening. Hi, this is Sablin Shop. My apologies, I came in a little bit late. I was a
No
little
problem.
sick.
No problem.
I'm sorry, was there anything that was key that was mentioned? I did come and listen to the tail, and I was having also a problem with my speakers. Is there anything key that was said in the beginning that could be restated, please? Not to make you repeat yourself.
It's okay, no problem. So basically, one thing is that I'm trying to get in contact with any nurses that are involved in the nurses strike to see if there's any support that CB17 can offer. Second, that we're starting to gather resources and plans for the April Community Board Fair. Third is that next month for this meeting would like to have, or we're planning to have some HIV/AIDS education from Community Health Network. So gonna distribute a flyer and would appreciate support, sharing that wide so we have more people. And then lastly, just a reminder that Downstate is hosting a blood drive today and tomorrow if people want to donate blood.
Thank you so much.
Of course, no problem. Does anyone on the committee have new business that they'd like to discuss? And I'm also curious, does anyone here know anyone who's participating in the nurses strike right now?
I have a high school classmate who's on the picket line, but I think she works for like Mount Sinai
Okay,
and she lives in Queens.
got it. Okay, so not Central Brooklyn based.
Sorry, this is not related to the nursing picket line question. My question is, with what's going on with Downstate, I know they did stop them from closing. Did you share any other updates on Downstate or anything that's going on? Actually, I happen to have gone there. I wasn't doing too well. And I have to tell you, great customer service. They really are a good team.
Yeah.
I was like, their hearts are in it. I even told them, you know, don't believe what's written in the articles because you guys really, their hearts are in a lot of things. So is there anything coming up with downstate and what's going on? I mean, you know, things can get lost, and I know you've been our main source of communication with the outside.
Yeah, I can ask. We have a community representative at Downstate that you know, we're in touch with regularly. I can ask if she would be willing to come to one of these meetings also to share. I don't have any new updates. The most recent updates I have is that, you know, the budget was passed, and, you know, a significant amount of money was invested into Downstate, so they will be eventually going under a fairly significant renovation that is going to decrease the number of beds, so the number of inpatient people that they'll be able to take care of, but ideally really increase the quality. Like, part of the reason the number of beds is going down is because they want to make sure there's a bathroom in every single patient room so that patients don't have to like go in the hallway to use the restroom. So, you know, the rooms will be larger but more private, and sort of just like streamlining the people that they're actually taking in for inpatient. That's honestly what I can remember off the top of my head, but I will ask Ms. Goodrich if she can attend one of these meetings to give us like a more in-depth lay of the land on where things stand with Downstate right now.
Thank you for that. Now I'm going to ask another silly question. Are you one of those people who will have a seat at the table? Because one of the things that we do notice in any community, you know, everything really starts at a community level. Like a lot of money gets poured into something, then there's a lot of complaints afterwards, meaning that people are not satisfied. There's a disconnect with who's at the table, vending, the vendors, and of course the outcome. And there's always going to be a ribbon cutting and all of that. But with understanding that space, and that I think you've been the liaison, do they invite people at the table? Because now we have a new mayor. In other words, there's a lot of multi-layered things going on, right? We have
Yeah.
a new mayor. There's politics is different. We understand about health and prevention, but where does our role? Does our role, you know, gets a little bit more closer to certain things? Because downstate is really key. If you close downstate, right, what would have happened? I mean, I saw how they did the big need, and yet there had to be a fight for this. So now with this money pouring in, when people are aware of the money pouring in, when are people aware of the starting of the changes? I'm not saying that you shouldn't have a bathroom in every room, but what other factors should be considered? What did they know before? In other words, what were the issues before that are now going to be addressed? I don't think all 30 of them will be addressed, but what are the top 10 that should be addressed to make this a place that's, you know, that's more in this century, basically. Thanks.
Yeah. No, I completely understand. To answer your first question, there were, you know, several committees, and there was a lot of community input. There's a group of local clergy people that were really you know, their voices were very heard. They were prominent in the argument. And then there was also an organization that I was part of, and it was like a task force, I would call it, not a full organization, that I was a part of. It had members of CB17, CB9, and other community members. And that organization met, or that task force met regularly, and then would send their, you know, demands to the governor's official task force. I was not on the governor's task force because she requested one person between CB9 and CB17, and the person from CB17 was just the one appointed. But, you know, downstate, I think it's technically in CB9 just because of the street that it's on, even though it obviously very much serves CB17. So I feel like the community is adequately represented. But I think what you're getting at is that we need to make sure that there's like a good amount of oversight moving forward. And I would say that Ms. Goodrich is the person to really talk to about, you know, how the hospital is making sure to continue that these voices are heard now that the plans are in place, because the official plan was voted, right? They selected the exact number of beds and, you know, got the architectural bid for how many beds they can fit in the building with bathrooms and that sort of thing. So those things are set. But to your point, you know, I think there's questions about like the programming that they have and like the way that they outreach into the community, that we can just like continue to be in communication to make sure that there's like consistent oversight, that they are committing to the things that they agreed to. So I will do my best to see if she can join our meeting next month to answer some of these questions.
I
Thank
think
you.
it's also a matter of making sure that we hold not just downstate accountable, but are they're overseen by the governor and much higher level state officials, and making sure that we as a board continue to communicate with them, and maintain an avenue of communication to make sure that they're aware of what issues are going on and what needs for improvement, and also that there's not disinvestment, that they continue to provide funding for the hospital.
Yes, I do agree. In the fight to preserve downstate, our representatives were really vocal. Brian Cunningham, who's our state representative, was I think he was really key in making sure that downstate didn't close because it was initially Hochul's decision. So I will say overall, I do feel that our local representatives are champions of downstate, but I think we just, as you said, need to continue to communicate to them that this is something that constituents, care about and want to see them like active in.
Maybe having like a like every 6 months having a rep from downstate come into and address the board, and or the community board at large about what's going on at downstate that is relevant to the community.
Ms. Goodrich does attend the wider meetings regularly. She doesn't always speak, but she's usually there. But I can just communicate with her a little bit clearly about like what we want to hear, because often she'll come and just tell us maybe about events that are going on at downstate.
Yeah.
One thing she mentioned, I spoke to her after the meeting last month, and she said that part of the issue is, downstate is a teaching hospital, so a lot of the doctors there are students, residents, and they have a lot of affinity clubs, like they have or a specialty club. She was like, they have a cardiology club, they have like a sickle cell, interest groups. But they don't always know what's needed in the community. So they might be getting together and talking about, cardiology from a clinical perspective, and they're trying to figure out how they can be helpful to the local community from that perspective. So I think that's like part of where the blood drive came out of, was one of these student groups. Unfortunately, she did emphasize that it's like she's the only person doing this kind of work. And so, even when trying to sort of guide the students, even when she's trying to guide the students, there's like just limited, I don't even want to say capacity because they can do the work, but limited knowledge. So I did ask her if we can possibly get in touch with some of these student groups to have an idea of what they're working on, how we can collaborate. But again, I will try and get her to join our next meeting so we can talk to her a little bit more directly.
Yeah, I mean, even as a student, we used to do like blood pressure drives and like basic education. But I find it surprising because even like they have a school of public health, I think, and so the public health students do a lot of their career track is going to work for local health departments, like, and so that would be a helpful thing probably to have them come out, because they would read more of the epidemiological data that's more community oriented and know what are the issues facing various communities at that level, because that's what they're being trained to do, not necessarily like administer patient care, but administer health education and management from a public health standpoint and through a health department standpoint in terms of what they're looking for as concerns. So also including the public health, if there's this public health students, if they're available to do something like that. And there are also, I know med students or nursing students who are also probably also going on a public health track and would be interested in that too.
I am just writing this down. Thank you. Thank you. Khadijah, I saw you had your hand up.
Yeah, quick question. How come we don't hear nothing in regards to Brookdale of things that they're doing in their progress and some of the concerns from the doctors and the nurses and just the administration?
Tiffany? Tiffany, are you still on the call?
Yes, sorry, I'm here. Nothing for me, thanks.
Well, I just want to know if you have any thoughts on Khadijah's comment.
To expand on it, no, not really. I think I'm more in agreement with what she said.
Okay, so when you do have the Brookdale CAB meetings, do they?
Next. Oh, sorry. Go ahead.
Yeah, I'm just trying to get a sense of what the meetings are like overall, or in the past. Like, yeah, go ahead.
So the last one, I know he said they're gonna resume next month. They've only been about 2 since I've been on, since I just recently became the chair, but they're more so, it's been mainly the Brookdale updates. Like I think the last one was more so of like different advancements that's going on. Um is with the hospital itself. A few things they did touch on with the community. But I did ask, what's his name, Wayne, just to give me more of like something like an agenda since I am new. So I guess when I get that, I will have more of an idea of what their what their true basis is, because Daly actually did not explain that to me when he put me on.
Got it.
So yeah, so I'm actually like filling it out myself, but that is really the basis of what is more so the updates from Brookdale and like a few things more health related in the immediate community.
Mm-hmm. Okay.
So he said they're going to resume next month. That should be next week. Next week, Monday, will be the
Okay.
next one.
Okay. Great. So, I think part of it, Khadijah, just to answer, is that we just have a closer relationship with the the staff member at Downstate. We have our meetings there. She's kind of the liaison for how we were able to get that space. So I think that's some of it. Um, I'll follow up with Tiffany after the next CAB meeting. Downstate also has had a CAB in the past. And for people who don't know, CAB, I believe, stands for like Community Access Board, something like that. Don't quote me. I know Downstate has had one, but again, because Downstate is technically in CB9, the CAB representative for the community boards is a CB9 member, not a CB17 member. But I don't know if the Downstate CAB meetings are actually even active or not. I think they go in and out. So, Tiffany,
Daly did say that as well.
sorry?
Daly did say that. I think they're not as consistent as the Brookdale CAB meetings. I think he did know that.
Yeah. So I think the key might just be to get, like a decent relationship with someone else at Brookdale that's in a similar position to Miss Goodrich at Downstate to see if
Right.
they, just keep us a little bit more informed.
I agree. Okay.
Okay. Any other thoughts, questions, or new business?
Thank you for answering me.
Of course.
Sorry, I just want to, I'm sorry, this is Sabin again.
No
On the
problem.
Brookdale question, I'm usually, my questions are always particular with Brookdale. Specifically, there's always a new administration, or at least I don't think it's like new, but people who have like interim roles. So I don't know if we mentioned this, if there's anyone in an interim role, if they could also be willing to come and talk and kind of just give an update, because it's always great. But I thought I thought we had a representation here. I'm sorry, I don't want to call anybody out, but I can't remember. Of someone who would come and just really speak to what's going on, speak someone to a much higher up. Because there's always all these questions, granular, small questions that we can't seem to get answered. Like I'm big on, okay, we have an electronic medical record, we get a lot of information. Are there anything that's being done with the data that's gathered or initiatives that are being changed? Again, I focus on the top 10. I think our group can do those kind of questions for them, not to put them
Yeah.
on a spot, you know what I'm trying to say, but we're okay. As a community board, it's okay because we have enough knowledge and we're all subject matter experts in our own right. And we defer to you to kind of put them and ask them these really questions that maybe the general public doesn't have time to ask them. We're not being reporters, but we're like, hey,
Mhm.
and it's okay. It's a safe space to kind of just ask these questions. Like I always ask these questions. So what's being done with data that's collected? And then we tie it back to health, right? It's always back to health for us.
Yeah. I think that's a good flag. So to answer the bit of a question that you had in there, the person who spoke, Tiffany Anderson, she is a community board member and is assigned to attend Brookdale's community meetings. I think the problem is that they're not consistent and they're not always super informative. So maybe what could be helpful, if we as a committee can come up with a list of questions that we want to know from Brookdale and maybe send Tiffany to the CAB meeting with those, so she can share them with Brookdale staff, and then maybe they can, you know, share some information back with us. I think that would be helpful. Sabin, if, you know, maybe you could jot down a couple questions and
Sure.
forward them to me.
I definitely
That
will do that. Yes, thank
okay,
you.
thank you so much. Yeah, of course. That would be great. And you know, transparently, I think if we give Tiffany the questions this week, I don't know that we'll get answers next week because, you know, I don't know who's on the community access meetings. You know, they probably have to go back and actually get the data, but at least we can give them an idea of the kind of things that we, you know, want to know and the like level of involvement we want to have with what's happening at Brookdale.
Thank you. I thought one time, I thought the CEO did come to speak with Tiffany. Thank you for that, and thank you for that.
Thank you both. Yeah.
Montserrat. The thing is, and I know I'm going to sound a little picky. It's almost like I know enough about the Brookdale community. I find that sometimes you got to get the right people. You got to get the people who are the decision makers. And yes, Tiffany, great, you know, as a communicator. I just find sometimes we don't know the right questions to ask. Like I'll put my questions, but I think it's also helpful for everybody to ask really general questions because as a community board, we speak for the public, really, the people who don't have the voice to speak for themselves.
So are you saying that like there's somebody else that you want to come to the meetings, or what exactly are you trying to say? I'm sorry.
I was under the impression, I remembered a while back, and when I'm sorry, maybe it's my cold, where I thought the CEO would come and actually speak to us. I remember there were, it's been a while, somebody came from that and they spoke to us, like giving us an update.
I'm not gonna lie, it's not coming to my mind, but that doesn't mean it didn't happen. It's just not in my brain. But I'll reach out to Miss Fraser to see, you know, if the CB17 in general has like a connection with someone, you know, higher up at Brookdale, because I do hear your point, absolutely, and I do think it would be worthwhile if we can get like an overall update. Like one of the things I remember is when they were reducing Kingsbrook, we had a representative from OVH come and give us like an overall update on where OVH stands and, you know, what they were trying to do with Kingsbrook and what they were going to move to Brookdale and what they were going to move to Kings County. So I do remember that, but I'm not sure if it was like the CEO of Brookdale or anything specific. So I can dig around a little bit more for that.
Correct. That you're right. Your memory is great. You're right. I remember at that high level, we got someone who was an executive who came to speak with us. And that's when I remember that. And that gave us an overarching view, allowed us to ask certain questions. And it's the direct source, even if the person would redirect some of the questions eventually to the liaison or representative, but we had that representation. So it's great. And even Tiffany will have more questions, but I always thought I remember that we had asked for that. That was one of our wish lists, that if we can get people like that, whether it's, I don't know, one of the executives to come and speak, because then that means they're taking the time. They know about us. They're taking the time to come and prepare to answer questions or give updates. And that was a big thing, because think about how busy a CEO and executive is, and they're coming to give us 15 minutes of their time. So it says a lot.
Yeah, I hear you. Okay. Tiffany, can you and I connect about this, and then maybe we talk to Ms. Fraser to see, you know, who we can reach out to?
Yeah, definitely. And then I was also thinking too, I'll even like get like a full list of the members that come on. And then, you know, if there's a role that may speak out that you guys may want me to connect with personally, I can do that too.
Yeah, that would be super helpful. Thank you. Any other new business or thoughts on anything we've discussed so far?
This is Ms. Reed. Just to do clarifications, the CAB is the Community Advisory Board, and I believe
Amazing.
it was Kings County that has the CAB, not downstate, unless downstate has one now, but it was Kings County.
No, you're right. I mixed them up. Thank you.
That was that liaison for the Community Board 17. For the CAB at Brookdale, if you want to reach out to Sharon Devonish Lead. She's the director she's the director of external community affairs there. She might be able to give you some insight because she was very much involved in the CAB when I was on the when I was the CB17 rep there. So if you want to reach out to her, and she usually liaison with Miss Fraser, so you can get her
And
get
can you
her
repeat the
information
last
from
name? I
Miss
heard you
Fraser.
say Sharon.
Sharon Devonish Lead, Leid, Sharon at SHARON. And she's the she's the director of external community affairs at Brookdale.
Okay.
Thank
You
you.
so much.
You're welcome.
Okay, any other new business or thoughts? I just want to ask a favor, homework, I guess, would be as we're thinking about the April community fair, if people can really think what contacts you have that would be willing to participate and come to the February meeting with those, that would be really helpful so we can be productive. And as a reminder, we will have an educational portion of that meeting. So flyers will go out shortly, like within the next week or so, just so that we can spread it and get as many people to it as possible. But then also to do, some work in that meeting, would want to start inviting different community organizations to help or to participate in the health fair in April. Okay, so that is new business. If there's none, we can move on. Is there any old business that anyone wanted to bring up? So one piece of old business that I did want to discuss, we had talked about doing the social services health corner of the newsletter. I don't think a newsletter went out for January, but Vanetta, is that still something that you're able to draft?
I can. It's just I've had a lot going on, but yeah, it should be
I
something I
understand.
should be able to
I understand.
draft.
I'll have. Do you need
So,
anything from me to get a potential January, February draft?
I think we had talked about a topic for January. I wasn't sure if you want to move that topic to February.
I'm not gonna lie, because I'm at my mom's house. I don't have all of my notes with me. So I'll connect with you offline and we can just pick, settle on whether we're gonna use the January or February one. Okay. So that is unless anyone else has any old business, that's all I have. Okay, Ms. Lyons, do we have quorum now by any chance? Ms. Lyons, are you there?
You are one person short of quorum.
Oh, okay.
I did want to ask you this. This is the 4th month. So the 3 since we adjusted your attendance. So would you like me to go through the 3 months to adjust it again, or
yes,
you want to wait?
please. Yes, please. Let's adjust it again.
Okay.
Thank you.
No problem.
Okay, so if there's no more old business, I think we can move to close the meeting. Do I have a motion to close the meeting? Or a motion to adjourn, sorry.
Motion to adjourn. Vanetta Sylvester.
Thank you.
I second Janice Reed.
Thank you so much. Okay, as always, thank you all so much for your participation. Please look out for a flyer for next month's meeting. Please, everyone, stay safe, stay warm. Khadijah, is your hand up from something new? Okay, I'm gonna assume it's an old hand.
Janice.
No, you're good. Okay. So everyone, please stay warm, stay safe. If you need help shoveling, reach out to your assembly people because there are services available. If you can get them, and looking forward to
Monica,
connecting
can
with
you,
you.
I'm sorry to cut you off. Can you
No, you're
put
fine.
in the group, in the, what is it called, the WhatsApp, the information for the people who can shovel the snow, please?
Yep, I will.
Thank you.
How do I get on the WhatsApp group? Because I'm not on the WhatsApp group.
She's talking about the executive committee WhatsApp, but I can make a WhatsApp group
okay.
for the social services committee if that might be helpful for us to be in contact a little bit more regularly. So I will do that. I'll do that and send out an invitation through email. And if you'd like to join, please just join through that link. That would be great.
Thanks.
Of course. Okay. Thank you all. Please stay warm and have a great evening.
Okay, good night.
Stay safe. Good night.
Thank you.
Good night.
Thanks.
Bye, guys.
Good night, everyone.
Night, Ms. Lyons.
Good night, Miss Khadija.